It's quick and it's permanent and it's all the rage, permanently changing your eye color. Social media influencers are helping to fuel this trend. Here's Health Check 10 reporter Barbara Morse.
It was a doctor originally from Russia who founded Corrado, the first practice of its kind in the U.S. that specializes in cosmetic eye color change. He's an ophthalmologist who says he's been researching this for years and claims it's safe. He's gone from doing a dozen a year to more than 400 annually.
It's extremely quick. There is zero pain and you get immediate results.
Reva Stout was born with brown eyes, but she's quick to tell you.
I've always wanted light color eyes.
So when images started popping up on social media of people who'd permanently changed their eye color, she did a deeper dive.
I've done my research.
And then decided to take the plunge. Now, mind you, she lives in Atlanta, and this was being done in New York City. But she didn't hesitate when 4 years ago she called the Corrado office and talked to the receptionist.
This was on a Monday, and she was like, can you come tomorrow? Now, mind you, this is in New York. And I was like, yep.
A round-trip flight, $10,000, and a 30-minute procedure later, Reva's eyes went from brown to honey. Her doctor, Alexander Movshovich, who brought this type of permanent eye tattoo known as Corrado pigmentation to the U.S.
These pigments which we're using, they are made in France, and they have track record of using them in the medical field for more than 20 years.
What he does and says he's perfected is using a laser to open the eye. Then he places a permanent pigment into the cornea. That's the transparent cover over the pupil. You can go from any color to another color, almost in the blink of an eye. He'll tell you it's one part medical expertise, one part art.
I do the photo of their face, and one of my colleagues do the simulation with all 9 colors which we have.
And he makes it clear this is, for the most part, permanent. So be sure. Also know this procedure is not FDA approved for cosmetic use.
You are permanently changing the cornea.
Dr. Michael Migliori is the ophthalmologist in chief at Rhode Island Hospital. His thinking is in line with the American Academy of Ophthalmology.
One of the things that ophthalmologists think about, well, if this person needs cataract surgery or just needs their eyes dilated to be able to see in the back of the eye.
Other concerns include light sensitivity, injury to the cornea, and inflammation, reduced vision, or blindness.
Listen, it's a medication, and any medication can have some degree of reaction. Thank God at this point, there is no major reaction.
Dr. Movshovich says he's done more than 1,200 of these procedures and is continually improving on his technique.
I'm still amazed.
Reva had it done twice. Remember, her first change was to a honey color.
It was very pretty. I didn't want to look like a vampire.
So she went back to Corrado and had some of the pigmentation removed.
So I switched from honey to hazelnut, which is a more natural look.
As for years from now,
I pray, down the line that nothing but, here we are 3.5 years later, 2 times, and no, everything is good.
Dr. Movshovich tells me changing the pigment is not an exact science. It can be lighter or darker depending on how your cornea absorbs the mineral. If this is something you're considering, do your homework, know the pros and cons, and be sure this is what you want. I'm medical reporter Barbara Morse.